And that turns the logic of Obamacare right on its head. Let's bring in the Real Deal Squad. Tanya Acker, lawyer and Huffington Post blogger. Leslie Marshall, radio host. Greg Knapp, radio host and columnist for Washington Insider. And Ben Ferguson, also a syndicated radio host. Greg Knapp, let's start with you. What do you think? I think the cost is going to run far out of control, and yet Obama has got us convinced that he's going to be able to cut costs.
Well, here's the thing. The first bills were so bad that anything looks better. So, oh, it's not $1 trillion or $2 trillion, it's $900 billion. Woohoo, party time. No, it's going to cost way more, as you just mentioned, because it always does. Taxes will go up, services will go down. And Dennis, if you look in Obama's own words, he said he wants to slow the growth of services, not just costs, but of services. I don't want that in my health care.
Right. Tanya, what do you say?
The services that he wants to slow are some of the administrative inefficiencies, some of the duplicative testing. I mean, these are things. This is part of the reason why you've seen costs in some of these other programs. That's a big part of it, and that's what we're also going to see savings when we get some of those costs under control. Now,
and the tonsillectomies that the pediatrician just wants to get paid for, right? The tonsillectomies that he only did for money, are those the services?
This is exactly what this debate's becoming about, because we're not talking about health care, but what people are doing, what a lot of folks from the right are doing in particular, is trying to use this as a mechanism to beat up the government, to beat up the president.
Let's talk about health care.
It has nothing to do with that. You're making things up.
Guys, one at a time.
Hold on a second. Hey.
One at a time. Ben Ferguson, go ahead.
Let's talk about the god of the health care debate here. It's not Obama. It's not the House Democrats. It's not the House Senate. I mean, the Senate or anybody. It's the Congressional Budget Office. And not once, but twice, they've come back and they've said that this bill is going to cost too much money and it's not going to save anybody any money. Now, if I'm listening to the president and what he says, he's saying that we're all going to have to sacrifice. Why would I sacrifice for something that's going to not save me money? That's my only question tonight. And if you can answer it, I will give you my good health care.
Leslie, you answer it. Leslie.
Well, it cracks me up that in America, we get upset if a bridge collapses, but we don't want to pay taxes to keep the infrastructure strong.
It's not answering my question.
And
my question is not that.
I am answering the question. I'm doing it my way.
Well, that means diverting the answer.
I'll tell you, sweetie, you can't have any reformation of the healthcare system when you have to have a reformation of the cost of the healthcare system.
They're saying I'm going to lose services. Your president's saying I'm going to lose services.
What services are you going to lose?
We're going to be keeping you around, and you're going to be able to argue a lot more tonight. Okay, so I'm going to bring you back in a few minutes. But for more now on how the Blue Dogs were brought to heel on health care reform, we have Republican Congressman John Campbell. He has been vehemently against this plan, and now maybe he can tell us just how painful it will get. Thanks for being with us tonight, Congressman. So did the Blue Dog Democrats give up too easily and too early here, sir?
Yes.
I don't understand that connection.
Let me ask a question. Congressman, can you hear me? Can I ask you a question? My question is this. If this bill is so great, why won't the Democrats take it as their own health care?
Oh, I was actually just going to go to that. There's a bill out there that I have co-sponsored, and a bunch of Republicans have co-sponsored, and we've said, look, if we pass this bill, everybody in Congress needs to go on the public option and only the public option. And not a single person who's going to vote for the bill has agreed to co-sponsor that yet.
Congressman, if we were in court right now, I think I just won, just over the other lawyer, just to know. I mean,
well,
if this thing is...
Let's let Leslie get a crack at the congressman. Go ahead, Leslie.
Answer my question.
Well, now that Dennis asked that, I forgot your question. What was your question now?
She was wondering what's the big deal with the public option plan.
Yeah. Because, look, the president is in California than a doctor under this plan.
Congressman Campbell, it's so great of you to be with us tonight. Thank you so much, and thanks for letting the Real Dealers get a shot at you now. And Real Dealers, you guys are not finished. We have a doctor that hates the president's plan. He's going to explain why, and then you guys get a chance to jump on him too.
And the patients, and sometimes who gets in the way is the insurance companies. The insurance companies are taking a lot of money out of the system, and I think we don't need to necessarily create a completely new system. We need to kind of fix what we have and come up with a solution for the uninsured. It may involve a government component to it, but I don't think we have to come up with it within a matter of weeks.
All right. Thanks very much for being with us tonight, Dr. Urschel. Much appreciated.
My pleasure.
Let's get the Real Deal reaction. Tanya, Leslie, Greg, Ben,
With all due respect to the doctor, I think that he's repeated a lot of misstatements about this plan. I mean, as an initial matter, we're not talking about a completely government-run, government-dominated plan. But he does make a good point about the impact that insurance companies are having on people's coverage. Insurance companies right now are rationing coverage. Insurance companies right now are denying care. So the parade of horribles that people are putting out
it is employers who are telling insurers, hey, you're running the plan for me, keep the cost down. We blame the insurers, but often it's like 138 million people insured by their employers, and the employers are the ones keeping the purse strings.
Let me tell you something.
Let me ask you a question. Can anyone out there, and I mean this seriously, can anyone name something great that happened with government that was rushed through where you couldn't read it? Even Obama himself back in 2004 accused the Bush administration with their budget of pushing it through too quickly and said, you can't read
Leslie?
it.
Why the rush, Leslie?
Politics?
It's a bum's rush, Leslie. What do you say?
He's losing
first
support.
Of all, I don't agree with the rush. I don't agree with the rush at all, and I've always said that, and I maintain that. This is a huge problem, a huge system that needs to be overhauled from the health management sense and side to the cost side. I do believe not a checklist for the president, but the president himself said, look, if this doesn't happen by January, it probably isn't going to happen. And I don't think that he's being a naysayer. I think that he is expressing some frustration rather than apathy.
Because he knows the more people know about this plan, the less chance it is to go through.
Saw what happened.
Hey, wait a second. Did you hear what Congressman Kanye said?
Because he saw what happened with current Secretary of State at the time, First Lady Clinton, and former President Bill Clinton's ideas. And
the problem there wasn't that they took too long. The problem was they had a screwy plan.
First of all, what is screwy about this plan? You keep talking about government plans, but nobody is complaining, nor has anybody complained for the past 1, 2, 3 decades about Medicare, which is a completely government plan. By the way, the government has been reducing doctors' salaries through Medicare, and the private insurance companies have been reducing doctors' payments through the privatized.
Guys, we're facing an unfunded liability through Medicare, I believe it is, of $38 trillion over the next 75 years, $9 trillion just for the prescription drug program that Congress passed without passing any accompanying tax increase. I mean, the fact is we cannot afford this. What I want to know is why, if this doesn't pass by January, Leslie.
To keep it the way it is. We can
if it doesn't pass by January,
why does it fail? Rush it. But we don't avoid it and keep what we have now. What is your alternative?
There's a very easy way to fix this. You go to the 5%.
And it needs to be reformed. We don't rush it by January. We need something.
You go to the 5% of Americans who truly cannot afford coverage. You give them coverage of disaster coverage for when they end up in the hospital, and you give them coverage of chronic care. Otherwise, they pay for the middle.
Million people.
You know what? No one's going to understand that. Leslie, no one is going to hear us if we keep talking all at the same time.
Let me jump in here.
Please stop. Jump in, Ben.
All right. Here's my thing. Look at the polls. The average American right now is not in favor of this. That's what the polls say. The reason why Hillary Care didn't pass is because it wasn't the plan was so screwy. It was the American people didn't like it. When the president says that you're going to save money, but then you know that you're not, and then you have less, you don't have as many choices, it's a bad plan for America. That's why he has to run it through right now. Because if he doesn't,
you are repeating misstatements and misinformation about what's on the table. The notion that there is the notion that we will be the notion that we'll be reducing choice is just another one of these sound bites, and it's not accurate. Wait a second. The Congressional Budget Office. The Congressional Budget Office said that you're only going to be talking about maybe 9 to 10 million people who would migrate from their private insurance company to a public plan.
Got to cut it there, Greg. I'm sorry. Got to cut it off. And the Congressional Budget Office that Tanya just mentioned also said this thing's going to cost over $1 trillion and not bring down costs at all. Thanks very much, guys.